Hello, hi, and thank you everybody for coming today. I'm Oliver's mum, and I'm the proud mum of this wonderful young boy, and I'm going to tell you a little bit about Oliver and his story. So from the moment Oliver was born, we knew that he was special, and our love for him was overwhelming. Oliver was born premature and developed meningitis at 3 weeks of age. He was very ill, and we were told that they did not expect him to survive. However, Oliver began to recover. Everybody who came into contact with Oliver warmed to him, and they could not resist spending time with this baby. Sadly, Oliver developed a second episode of meningitis, and he was incredibly ill again. But Oliver, the way he was, amazingly, against all the odds and many months of hospital treatment, Oliver's strength and determination shone through, and he survived once again. And always with that beautiful smile that you can see up there, that everybody was drawn to. As a result of an infarction, so basically Oliver had had a stroke as a result of the meningitis, Oliver was left with mild cerebral palsy, focal epilepsy, and later on a diagnosis of high functioning of autism. However, Oliver's disabilities didn't hold him back. He had a can-do attitude, and he simply amazed everybody with his achievements. He played for the South and Northwest Centre of Excellence England development football squads. He was a registered athlete with the power of 10, and Oliver was actually ranked 3rd best in the country for athletics. Oliver was a member of Team Bath, and he was being trained to become a Paralympian. Oliver was a natural leader and became a prefect and was chair of the school council, and again was selected once he reached college. He attained several GCSE and BTEC examinations, and he went on to attend National Star College. Now, their opinions of Oliver were very complimentary, and he was often mistaken to be a member of staff. They talked about how friendly he was, how kind, and supporting other students that were far less able than himself, his wicked sense of humour, and the aspirations that they had for him for starting a sports course at a local ski centre. Oliver brought so much happiness and fun to our lives, and he always saw the best in everything and taught us all how to look at things differently. Oliver never failed to light up a room with the sound of his laughter, and he wanted to make everybody happy, and he did his best to achieve that. Despite his limitations, he never complained or ever asked, "Why me?" And he accepted everything, and always with that beautiful smile. His encouraging enthusiasm was inspirational. We were told by his neurologist that Oliver had a full life expectancy, and that he would live an independent life with a minimum amount of support. In October 15, Oliver was admitted to Bristol Children's Hospital, having what we, his parents, and college staff recognised to be simple partial seizures. Now, rightly so, these seizures caused Oliver to be anxious, agitated, confused, and frightened. After several weeks of tests, Oliver was discharged home, and he was given sertraline, an antidepressant medication to treat his anxiety. Now, we were quite shocked at this because Oliver was not depressed at all. Now, once this medication was increased, it caused a change to Oliver's mood, and his seizures increased greatly. And he was admitted back to the same hospital in December 15. But this time, he was given antipsychotic medications. The doctors were misunderstanding Oliver's autistic behaviours to be an ictal psychosis, his normal autistic obsessions to be delusional behaviours. The effect on Oliver was catastrophic. Oliver's seizure threshold and anxiety deteriorated, and he was eventually held against his will under the Mental Health Act on a Section 2. We challenged this on numerous occasions, stating that we felt that the drugs were causing the changes to Oliver's mood and seizures. A psychiatric bed could not be found, and doctors decided to listen to us, and they removed all antipsychotic medication. And within days, Oliver's mood and seizure activity improved, and he was discharged back home into our care. A community psychiatrist wrote that Oliver was sensitive to antipsychotic and benzodiazepine medicines. In April 16, Oliver was readmitted back to the same hospital, again having simple partial seizures. And once again, the pattern was the same. He was anxious, scared, frightened, confused. And sadly again, Oliver was given antipsychotic medications, one of more of which caused a serious side effect called oculogenic crisis. And he was left like that for several hours because the doctors first believed it was behavioural. After 4 hours, he was given procyclidine medication to counteract the effects of haloperidol. Again, Oliver's mood changed significantly. He was hallucinating, having up to 30 seizures a day, which was something that we'd never seen happen. He had problems urinating. He had extreme high blood pressure readings. He was sweating, all of which were linked to the medications. We strongly believe the drugs were the cause of the decline in Oliver's mood, and it was obvious to us that the doctors and nurses had little to no understanding of autism and how autistic behaviours could present in a person with ongoing seizures. When in seizure, Oliver was always fully conscious, and because he had no control of the seizures, they caused him to be frustrated and scared. At my request, Oliver was transferred to a specialist adult hospital who I thought would have understood Oliver's epilepsy better. Oliver had been provided with a letter stating his previous reactions to all the medications he'd been on. But sadly, the extra use of physical restraints was increased, with up to 8 staff being involved at a time. Oliver was suddenly not allowed any privacy, whereas in the children's hospital, he had full privacy. He had 3 staff sat around his bed, and he was kept in a darkened room. Oliver was extremely frightened, and he told me just how scared the staff was making him feel. Remember, this is a person that never ever questioned or ever said once, "Why me?" And for the first time in his life, he told me how scared he was. And once again, he was given lots of different antipsychotic medications. And consequently, Oliver was detained again against his will on a Section 2, this time transferred to a mental health unit. However, once he got to this unit, the different approach from skilled staff allowed Oliver to improve within days. They were using reasonable adjustments. The words from the staff, including doctors, senior doctors in this unit, were that Oliver was not psychotic, he wasn't mentally ill, and that his placement was a total misuse of the Mental Health Act. The doctors reduced all antipsychotic medications, and literally within days, Oliver was discharged back home into our care again, but this time under the supervision of the Community Learning Disability team, with a letter once again saying how sensitive he was to all antipsychotics and benzodiazepines. The Learning Disability team were very supportive, and they specialised in people with autism and learning difficulties. The community consultant in psychiatry wrote, after his assessment of Oliver in the community, that his opinion was that Oliver was not psychotic, he was not mentally ill. He believed that Oliver's behaviours were a result of autism, mild learning difficulties, and an environment that was not adapted to meet his needs. So that was written down. Sadly, in October 16, Oliver had a cluster of seizures, simple partial seizures, fully conscious, but it's a seizure. And he was admitted to Southmead Hospital. Oliver told ambulance staff and also the doctors in A&E not to give him antipsychotic medications, and he gave a good reason why. He said to them, "They mess with my brain and they make my eyes go up." He was referring to oculogenic crisis. And he was reassured by the doctors that they had no intention of using those medications. We gave the doctors a folder of supporting letters stating Oliver's previous reactions to all antipsychotic medications, and this was subsequently written in bold red ink on Oliver's medical care charts, that he was intolerant to all antipsychotic medications. Oliver was intubated so that they could gain control of the seizures and they could do an MRI scan. The safeguarding officer was consulted on how to manage Oliver's anxiety when sedation was reduced, and his advice to the doctors was a non-pharmaceutical approach. If needed, use soft handcuffs, because they were worried that when Oliver woke up, he wouldn't be aware that he had tubes down his throat. So by this time, he'd developed pneumonia, and they were scared he would try to extract those tubes. And we were reassured that we should be there when Oliver was woken up, so that we would be a familiar face and we would be able to reassure him, being his parents who knew him best. We were told that just about nearly everybody in the community and in our society, everybody waking up from sedation would be anxious and agitated, because that's just what it is. Sadly, this advice was not listened to. Sedation was reduced without our presence, and according to staff, Oliver became anxious, quite rightly so. He would have felt scared, waking up to find the tubes in his throat and in unfamiliar surroundings without familiar faces. Sadly, sedation was increased. And we were consulted by a neuropsychiatrist who had met Oliver for 2 10-minute appointments in the community. And she asked us about giving Oliver an antipsychotic. We made it very clear about Oliver's previous reactions to this type of medication, supported by those letters that I always had with me. And we made it very clear to her that she did not have our permission, but more importantly, she did not have Oliver's permission to administer antipsychotic medications. Despite this, Oliver was given antipsychotic medications that evening. We weren't aware of it. He was given olanzapine, and it was done without our knowledge. When we found out the next day, we told the doctors and nurses that they didn't have our permission, and they absolutely did not have Oliver's permission to administer that drug. Over the next few days, Oliver developed a temperature of over 42 degrees. And because doctors said his liver function was elevated, he was not given any medication to counteract that temperature. And he was just given a blow-up mattress, something that looks like a lilo that you'll find on a beach, filled with cold air. It was totally ineffective. Doctors could not understand the decline in Oliver's condition, and they sent him for a scan of his liver and lungs. Unfortunately, it was several more days before they scanned his brain. And what they found was, words I will never forget, it was so badly swollen, it was bulging out the base of his skull. We were told that Oliver had neuroleptic malignant syndrome, a rare but serious side effect of antipsychotic medications. A week later, the decision was made to turn Oliver's life support machines off, and Oliver passed away several days later on the 11th of November, 16, Armistice Day, which is very poignant to us as a family because we are a military family, and Oliver was a military child. A life wasted due to doctors not communicating effectively with family and practitioners who knew him well and who were in daily contact with the hospital. We believe the doctors were arrogant, and we believe they were ignorant, and we think that they believed they knew better than Oliver. They knew Oliver better than ourselves as parents. They didn't consult wider when there was ample of time to do so. There was plenty of opportunities. We have since been told by the doctor during Oliver's inquest, who administered the antipsychotic drug, that she would have given it regardless of our wishes, as she believed it was in Oliver's best interests. And she said she would do the same thing again, given the same situation, knowing that Oliver is dead. Now, we understand that many people receive the medications that Oliver was given, often for managing a mental health condition, and they do so without suffering any of the effects that Oliver had. In Oliver's case, we had clear understanding that he was sensitive to these medications, and we believe strongly that they should never have been prescribed. We believe that Oliver's death was very preventable. We believe that Oliver was given excessive drugs due to medical staff not understanding autism impacted by seizure activity. They didn't ever try to adapt the environment to meet his needs. They made no reasonable adjustments, but used excessive restraint methods. They failed to make any communication with community-based professionals that knew Oliver best and who were working with him on a daily basis. We're talking about consultant psychiatrists here, but they didn't consult wider. If the guidelines and principles from the NHS England Stopping the Over-Medication of People who have Learning Disabilities project had have been followed, with healthcare professionals being able to listen to family and specialist colleagues, then we firmly believe that Oliver would still be here today. We believe that Oliver's premature death should be in the public interest. And we challenge every one of you today, when working with your patients, to ask people with a learning disability, autism or both, their families and carers, for their opinion and concerns about their treatment. Listen to all involved and show respect for their opinions and concerns. Do something about it and work in partnership with your patients and with your patients' families. Specifically, as people who provide specialist care in learning disability and autism, put those people at the heart of all your decision making. Respect their point of view. Don't make decisions without them. Enable them to understand complex decisions in a way that is relevant to all and provide information and explanation. Liaise with healthcare colleagues in general hospitals and the community and raise awareness and understanding of learning disability, autism and the principles of STOMP. Do everything in your power to prevent a story like Oliver's having to be told again. Now, MenCap, there are lots of campaigns happening at the moment, as I've mentioned. I've mentioned STOMP, I've mentioned Ask, Listen, Do, I've mentioned challenging behaviour. That is not the patient's challenging behaviour, by the way. That is your behaviour that challenges the person in crisis. And then, of course, MenCap have Treat Me Well, which is all about looking at the person and doing the right thing, treating them in the right way. So can I just talk a little bit about what reasonable adjustments are? Jake, wherever you are, can you come up? Where is he? Don't touch that. Right, Jake, today what I want you to do, right, I want you to go into my classroom. I'm a teacher. You are to go in today and teach my class of 5-year-olds. I want you to go in and talk about graphemes, phonemes. I want you to talk about digraphs, trigraphs. I want you to do oral blending, segmenting, partitioning. Okay, got that? How do you feel?
Uncomfortable.
What am I doing? What's wrong?
You're quite close.
Anything else?
You stood over me.
Okay. Did you understand what I said?
No.
Okay. Okay. Jake, are you okay?
Yeah.
Okay. What I want you to do today is basically, can you go into my classroom of 5-year-olds and I just basically want you to teach them how to read. So we're going to be looking at phonemes, which is basically letters. I want you to look at digraphs. So that's basically just 2 letters that make one sound. The trigraphs, we're looking at 3 letters that make one sound, so like IGH, I. Okay? I want you to break that word up for them. And while you're at it, you've got to, the oral blending is actually what they hear to what comes out of the mouth. Okay, how does that feel now?
Much better.
What have I done that's different?
Come down to my level and spoke in a way that I understand.
Has that had a different outcome for you?
Yep.
When I was in your face, Jake, can I just ask you, I'm going to come back up again. Do you have a learning disability?
No.
Do you have autism?
No.
Are you in crisis?
No.
If you had those conditions and I came to you just then, if I'd not made that reasonable adjustment, what do you think you might have done?
Maybe lashed out, got anxious.
And that's where we're going wrong, because quite a lot of the time this is happening. We're not making our reasonable adjustments, and a lot of practitioners are reaching for chemical restraint. Okay, thank you, Jake.